Well, today is a huge day. The Pfizer vaccine may be approved by the FDA by the end of today. Stepping back for a moment, how significant is it that we are on the verge of potentially multiple highly effective vaccines being approved in this country so quickly?
It is incredible. I mean, if you think about where we were on March 30th, I don't think any of us would have predicted that by the end of December or mid-December, we'd have vaccine. It is an incredible tribute to the vaccine community, to the scientists who have worked night and day on these vaccines to even get us to this point. It is a really exciting moment for the country.
It is for sure, but you have still warned that we have a stretch of very dark months ahead of us. Why?
Well, because it's going to take some time. These are not easy vaccines to manufacture, particularly these first two. So it's going to take some time to manufacture it and, of course, to get it out. And the first people who should get it are the elderly and the healthcare workers. And as Tony Fauci has said, it's probably going to be April or sometime in the late spring when it starts to get to all Americans. And so we still have some dark months ahead here in December and January and February as we're all living the lives that we're living now, mostly at home.
What worries you the most as we sit here this morning?
Well, what worries me the most is how do we get this vaccine out? How do we make sure we get this vaccine out to the far corners of the globe, these first 5 vaccines that are to come? Because everybody needs this vaccine. And if we only get it to the high-income countries, this disease is going to bounce around. We're going to see twice as many deaths, and our recovery of our economies is going to be much, much slower than if we get the vaccine out to everybody.
Twice as many deaths? I mean, explain what you just said to folks.
Yeah, so Northeastern University did a modeling of this, and we'll see twice as much death around the world if we don't get the vaccine out, because you're going to see far more disease lingering and lasting, and then we're going to see it bouncing back inside of all kind of countries. So in the United States, for instance, even for our global recovery, if we want to get manufacturing back up and working as much as we want it to, or travel back to normal, we can add, there's an estimate from the Eurasia Group that says we can add 200 billion to our economy in the next 5 years if we get the vaccine out to everyone and we get this disease tamped down around the world, not just in the United States or in Europe.
But isn't it playing out now in these first days as we see the vaccine distributed across the UK and hopefully very soon in the US, that it is the richest countries that are getting it first?
Well, there's a global group that has come together to try and make sure that procurement happens, not just for Europe and the United States, but for other countries as well. And part of this announcement that Bill and I are making of this $250 million is to buy 200 million doses for the rest of the world, for low and middle income countries. You know, there are other places this vaccine can be manufactured. One of them is Serum Institute in India. They're ready to take these vaccines. That will help us get it out. And then we need to think about distributing the vaccine around the globe.
So, as you just mentioned, $250 million investment donation from the Gates Foundation being announced today. This brings the total that you guys have put toward this effort up to, I believe, $1.75 billion. This goes largely towards equitable distribution, which your foundation has said is going to be even more expensive than developing a vaccine. What worries you the most about vaccine distribution?
Well, it takes a lot of planning to get vaccine out to these remote rural areas. We do know how to do it. We've done it before with lots of other vaccines, but the planning has to start now. Countries have to know which vaccine they're going to get, and then they've got a plan for it. We've done it even with Ebola, right, in the 4 affected countries. So, but the planning has to start now if in fact we're going to get vaccine there. And it's got to be purchased, manufactured, and then there has to be money there for it to be purchased. And so the world needs to put up more money to make sure that low-income countries can get the vaccine.
Is it, despite all this work that you're doing on this front, which will hopefully result in all countries having equal access to the vaccine, is it a correct assessment that it seems like the US, the UK, the richer, more developed nations are going to be on the front end of it, though? Are getting it sooner?
It does look that way, and
Yeah.
they put reservations down on vaccine. The good news is, though, that some of the European countries also, though, put reservations down, not just for themselves, but put money in a pool so that vaccine can be procured and reserved for the rest of the world. And so there's something called the Act A Accelerator, which is basically a global mechanism to try and give equitable access to COVID tools, not just vaccines, but diagnostics as well and therapeutics. And part of our announcement is to, again, make sure we get 120 million antigen tests out to some of the low-income countries, because they need to do quick turn testing and contact tracing to keep families safe.
Of course they do. The head of distribution for Operation Warp Speed here in the United States said just last week that by June, 100% of Americans who want a vaccine can get a vaccine. I mean, that's pretty soon. Do you think that's realistic, 100%?
With these other vaccines that are coming behind the mRNA vaccine, it is possible because the manufacturing requirements, they're not as hard to manufacture, and so the number of doses can be scaled up very quickly. So it is possible. I would say more, if I was put an estimate on, I'd say more summer sometime.
Okay.
I'm not sure I'd say June 1, but summer time frame. Yes, there should be lots of vaccine available in the United States.
As I listen to you talk about, equitable distribution of a vaccine, I think back to the driving force of the work that you and Bill do, and that is that all lives have equal value. And this is really a test of that. Do we value all lives equally around the world? Are we going to protect people equally? The president just signed an executive order, President Trump, to try to put Americans at the front of the line when it comes to vaccines. Granted, it doesn't really have any teeth because pharmaceutical companies have already made deals and guarantees with other nations around the world. But I just wonder if that's what you were worried about when you kept saying and warning against vaccine nationalism.
That's exactly what we were worried about. Instead, what should be done is the Defense Production Act, which is they should be scaling up lots and lots of manufacturing so that not just the U.S. gets vaccines, but everybody gets vaccines. So this reservation system is exactly the type of thing we were concerned about.
Well, what did you think when you heard the president say that?
I knew it was coming, and I was just incredibly disappointed. I'm much more optimistic about the president-elect and the COVID task force, this eminent task force that he's put together. I think we're going to see a lot more sensible policy making in the United States. But that starts, January 20th, and we have still some dark months to live ahead till then.
I know you've been talking to the president-elect's team a lot. Have you been speaking to the president-elect directly?
Yes, we have.
Okay. So what did you, and maybe you and Bill, tell President-elect Joe Biden you believe, task number one on day one is for his administration on this front?
Yes, so we're very like-minded. So yes, Bill and I spoke with President-elect Biden, and just, that the number one goal is to end this pandemic so that people can go back out into some semblance of normal life and to live their lives. And he is very astute, as we know, about foreign policy and cares a lot about foreign diplomacy and global leadership. So one of the things I know about President-elect Biden is he's not just thinking about how to keep Americans safe, he's thinking about global leadership, about how to keep everybody safe. And the great news is we will add more money to our economy if we get everybody else vaccinated. And so he knows if you want to get manufacturing back up and running, you want people to be able to travel, our travel industry to work again, hey, you got to get everybody vaccinated. So it was a very like-minded conversation, and we're just a small part of making sure that happens. But I think he's going to put a lot of wise people in the right jobs.
What do you think? What's the most important question he's asked you?
He's asked us what else should the U.S. be doing? How do you view this situation? And we had a robust discussion about the pandemic, obviously about climate change as well, which we're quite like-minded about, and also caregiving infrastructure in the United States. I mean, he sees what happens when the childcare industry is collapsing, what it means for a man or a woman, particularly women, though, to care for children and care for the elderly. He's been in that situation. He was a father caring for 2 children when he was a senator. He knows how hard that is.
A single father trying to do it for a while there. You, though, have also, I think, pushed the incoming administration on the caregiver front to do more. You recently wrote an op-ed, after tweeting mothers remain the fallback plan, which is true. I can attest to that. And you are calling on the incoming administration to create a caregiving czar. What do you want to see?
What I want to see is somebody at a high level in the administration coordinating across agencies, because when we talk about care, we don't just mean child care, we mean elderly care. There are 800,000 elderly people on the Medicaid rolls who can't get a good place to live right now. We have a child care industry that's collapsing. If you put $50 billion into it, you could help it start to revitalize it and make sure that Americans, if they want to go to their job or they're an essential worker, that they have somewhere to put their children that is safe. Those are 2 things that can be done immediately. And then long term, we need a good paid family medical leave policy in this country. But we need somebody in the administration high enough up to coordinate that and keep it front and center on the agenda. It is part of the rebuilding infrastructure for this nation if we're going to have a swift recovery.
There's no question. I mean, as you have said, this economy, the U.S. economy cannot recover if women are not aided in a major way, because women have felt the brunt of the job losses in this economic downturn, not to mention most of the child care and all of that. I guess my question to you is, and you've worded it as a shadow pandemic going on around the world. And I'm worried that there's not enough focus on it and not enough being done about it.
Absolutely, I do too. We know just in September, 865,000 women lost their jobs. 1 in 4 women say they're thinking of downshifting their career because they can't make it all work between child care and elderly care. So this isn't some side issue. This is one of the fundamental issues. What keeps our economy running? Not just men in jobs, but women. Women are 88% of our healthcare workforce. They're over 60% of the frontline cashiers. They're over 70% of our teachers. So I think we want women to return to work. So we've got to fix this.
Yeah, every administration in my lifetime has talked about this. And there's been a lot of talk and not a lot of action in the end. And I really hope that Congress is also listening and passes significant legislation to actually make this possible. In terms of minorities and Black people specifically in America, very troubling to see the new numbers out of Pew Research that only 42% of Black Americans trust vaccines right now for COVID. And it's understandable given the history of this country going back to Tuskegee and beyond. But I wonder what we need to do about that, and if part of the money you're putting toward this effort is going directly to Black communities on that front.
Well, part of the money that we have put forward is to make sure that Black communities, people of color, can get tested. If you're living in a rural area right now, getting a test, having access to a test and quickly getting the results can be near impossible in some communities. So you not only, if you get sick, you get your family sick or you get your community sick. So part of the money we've put into is making sure that people of color can have access to testing, whether that's at some of the historically Black universities or other places. We're also looking at how do you group up testing and have large-scale testing happen much faster. But yes, we have to address the disparities that people of color face in our health system. There are reasons they don't want to go to the health system, and even when they go, they're discriminated against or there's bias. We have got to fix that if we're going to have all Americans be safe.
Disinformation has been rampant, to say the least, throughout this pandemic. And it's rampant, once again, when it comes to the vaccine. What are the consequences of that?
Death. Disinformation can equal death. So if you don't do the right things to keep yourself safe, you or a loved one may die. And that's why it's so discouraging to see so much disinformation spread out there. Um, I think some of it is because there is a lot of anxiety. People are home more. They are looking at the internet more. We know if they go look at one piece of disinformation in a totally different category than their served up disinformation, for instance, in health or in vaccines. But one thing I do think will happen is as people start to see others taking the vaccine, healthcare workers, the elderly, teachers, people starting to be able to return to school and to normal life, I think they'll start to realize it is actually safe and I do want to take it. And what I tell everybody is ask your doctor. He or she knows what's best for you or your family. That's where you go for credible information, not the internet.
But unfortunately, a lot of people go to the internet, and you are formerly of the tech world. So I wonder if you could just speak to those in power at the tech companies, at the social media companies in particular right now. Do the social media companies, Facebook, YouTube, Twitter, on and on, have a responsibility to do more right now, Melinda, in terms of getting this misinformation, this disinformation off their platforms?
They absolutely have a responsibility. Anybody who's spreading information in society has a responsibility to spread that information safely and equitably. And so, I think a bit the internet and the rise of social media has happened so quickly that really the regulations and the good policy making hasn't stayed out in front of it. And quite frankly, it needs to catch up. And so that is something that Congress is going to need to wrestle with is what is appropriate regulation for these platforms, just like they have done with broadcasting many, many years ago with the TV or the motion picture industry. It's time.
Yeah, it's time. It's beyond time, and we can only hope for our children. I think especially that it comes soon. On education, I mean, the foundation's biggest investment in the U.S. has been in the education system. You've been working on this for a very, very long time. But the education system seems to have failed many of our children during this pandemic. And there's a lot of reasons why, and I understand this is uncharted, territory for all of us, for teachers, for parents, for principals, for mayors making these decisions and governors. But what do you think the lesson is learned about schools and education in this pandemic?
Well, I think what the pandemic has done is expose the cracks in our society. We already had these cracks in the U.S. education system. And who do they affect the most? They affect low-income communities and low-income students. And so because we didn't fix the cracks before, they're exacerbated. So a child may be at home and doesn't have access to broadband, doesn't have a computer, doesn't have anywhere they can go, or their mom, if it's a single mom with two kids, she's desperate to figure out who watches the kids while she goes on the bus, much less who's going to help them with their homework. So we've got to fix the U.S. education system. And I think one of the good things is that we're seeing is that the digital system gives us some opportunities. You're seeing middle and high income kids be able to go online and to learn. It's not easy. It's not the silver bullet. It's not how you want to do it all, but there have to be some hybrid solutions. And we've got to figure out how to bring those hybrid solutions of in-person and online effectively to all communities, particularly low-income communities. And I think digital gives us some opportunities and has accelerated in ways that we had hoped the last 10 years, and now it's really happened because of people being at home.
But again, we need equal access to connectivity, to laptops. I mean, the stories are, I think, an American tragedy of how many kids are missing out right now. Melinda, you have said we've seen far more deaths than was necessary in the United States from COVID. And I wonder how many deaths, if you think there are a significant number of deaths that could have been prevented with better leadership from the top, from President Trump.
We know there could have been less deaths. If we had started from the beginning or reassessed on July 1st or reassessed on September 1st, and instead of having 50 different state solutions, had a national plan for testing that was grouped up, that grouped up the testing so everybody had access to a lab and could get the results quickly, and then we did contact tracing, we would have kept the death rate down. We also should be telling people to wear masks. I mean, it's a practical solution. It's not comfortable, but it's not very hard to do either. We know masks make a difference. We know hand washing and social distancing. So we needed to be giving the right information and role modeling that for people instead of the opposite.
Can you believe that in America in 2020 we are still debating masks? I mean, have you ever seen a public health issue as politicized as COVID has been?
No, I don't think we have, but I think it's also because of the political polarization that we have in our country and we've had over the last 4 or 5 years. And so, but no, I would not have imagined public health would become so politicized. I don't think anybody could have.
2 more quick questions for you, and I'll let you go. The question has come up about profiting from a vaccine. I just wonder what your thoughts are on this. Pfizer, which did not take government money to create its vaccine, Pfizer has said it does expect to make some profit on its COVID vaccine. It's unclear how much. Johnson & Johnson, AstraZeneca, they say, you know, they're offering them on a nonprofit basis. How should Americans think about this? I mean, should pharmaceutical companies be profiting from a COVID vaccine? Is there anything wrong if they do?
You know, I think pharmaceutical companies should probably be profiting at sort of a marginal rate on this vaccine. They do need to make some money on it because, look, they did shift resources and scientists and manufacturing plants. So absolutely, and we want that great biotechnology in the future, and we want to keep them incented to do that. But I think they need to keep their costs quite low. And quite frankly, I think there needs to be tiered pricing between high income, middle income, and low income countries. And we're seeing some of them do that. And so I think the pressure that's been on them has been a good thing.
You said in a recent interview that you cry a lot and through this pandemic. And I was struck by that because I don't think a lot of leaders will admit that. But you've said that you know, experiencing and living that heartbreak really has helped you feel it and live and lead in a more effective way. I wonder if you could just speak to that.
Well, we had 2 family members who had COVID in March, not family members, friends of our family, and who we were in touch with multiple times a day. And to hear the terror in their voices, not knowing whether these family members would pull through, it makes it hit very close to home. And it was very early in the disease when we didn't know when or not to put people on ventilators.
Right.
And I think that by carrying that in my heart, it's helped me think about what does it mean for a person of color who lives somewhere in the United States, you know, in rural Kentucky to get this disease? Or what does it mean that mom I met last year, well, 2 years ago now in Senegal, what does it mean for her in the capital city and her kids? I know she was living right on the edge of extreme poverty. How are they doing? And so I think when you carry that in your heart, you're able to talk with world leaders from a very authentic place. And quite frankly, when I've been on the phone with several world leaders, they will tell you about the sadness and tragedy either in their own family or in their extended family or in their community. And they do feel it as well. They just don't often speak it on the global stage because they're expected to lead.
I think you can lead and be vulnerable at the same time.
I do too. And be authentic.
There you go. What's the most important thing, Melinda, that you have learned this year?
I have learned that we have a resilience that I think maybe sometimes we don't even realize we had as human beings, but we have a resilience and we have a very caring place for one another. I have seen some unbelievable acts of kindness, even in the midst of a lot of anxiety or freneticism. But I think we have a resilience as human beings that we have tapped into during this time, and I hope it's something that we remember coming out of the pandemic.
I hope so too. Melinda Gates, thank you not only for your time today, but for the remarkable work that you and Bill, the foundation, continues to do. You are literally helping heal the world, so thank you.
Thank you, Poppy.